In late 2012, the UK Prime Minister announced the 100,000 Genome Project, which is currently the largest project in the world, and is led by Genomics England, which is a company wholly owned and funded by the Department of Health and Social Care. The project aimed to sequence 100,000 whole genomes of NHS patients, something that at the time no one in the world had ever attempted. The main aims of the project are to create an ethical and transparent program based on consent, and then also to bring benefit to patients and to set up a genomics medicine service in the NHS. Another aim is to enable new scientific discoveries and medical insights, and also to kickstart the development of a UK genomics industry. In the UK, just fewer than 160,000 people died from cancer in 2011, and with over 330,000 new cases of cancer reported every year. Because cancer is more likely to occur as people age, we expect an increase in the number of cancer cases as people live longer. Although the rare diseases are uncommonly very rare, there are between 5,000 and 8,000 cases, and this means 1 in 17 of the UK population. Genomics has great potential for both rare diseases and cancer, because both of them are linked to changes in the genome. All cancers are genetic at the cellular level. Finding genetic markers in the tumor could help to guide treatment and predict prognosis. However, a small proportion of cancers are due to a germline mutation, which most of the times runs in the family. Such families have multiple affected family members with different cancers at a relatively young age. Finding a germline mutation in these families could help to predict the risk, which most of the times is up to 50%. Because it was the first time when sequencing at such a large scale had been attempted in the UK and worldwide, of course there have been several challenges. And one of them was to set up the Genomics England pipeline. Another challenge was the size of the data, because the raw data of a genome occupies hard drives, the memory of a laptop, it can be up to 200 gigabytes. Another challenge was to gather the information about every individual, every person involved in the project, and about their phenotype. So that was challenging to gather. And of course, a significant challenge was variant interpretation for clinical scientists and their clinical team, and to understand different disease mechanisms. Several patients have already received their results from the 100,000 Genome Project, and the figure I'm talking about is thousands of patients, and their results are delivered by 30 genomic medicine centers that were established when the project started in order to cover patients from across the UK, including England, Scotland and Northern Ireland. There have been several exciting results, such as GLUT1 deficiency syndrome, which helped with the treatment and to control the seizures and other clinical features.